Okay, good evening, good afternoon, good morning, wherever you are, based on your time zone. To those who is watching this video, today I will discuss the link between saturated fat and cholesterol, and I will begin trying to uncover the chemical nature and common dietary source of saturated fat. Okay, the common source of saturated fats are found in animal products and very few selected tropical oils. The animal products include animal meats like beef, lamb, pork, poultry, products with skin, and also the dairy products like butter, cheese, whole milk also include saturated fat. And on the other hand, processed foods, most of processed food carry saturated fat, and in most of the cases they hide, the manufacturer hide the presence of saturated fat, and we need to be careful. Some products like lard, tallow, and many baked products contain saturated fat. Regarding to the plant-based oils, very few selected like coconut oil, palm oil, and palm kernel oil contain saturated fat. If we notice, or if you carefully see, those oil are solid at room temperature, meaning that we need to give good attention that these are a very good source of saturated fat, and it directly contributed to high level of cholesterol. Okay, so again, comparing the difference between low density lipoprotein, which is the bad cholesterol, and high density lipoprotein, which is the good cholesterol. When we say the bad cholesterol, it carries cholesterol to our arteries, and when the level increases, meaning high level, leads to plaque buildup and narrowing the blood vessels, and it restricts the blood flow. It affects the blood flow, meaning that it will come back with the consequence of cardiac arrest and stroke. On the other hand, the high density lipoprotein, the good cholesterol, which we usually refer as a good cholesterol because it clears up the cholesterol from our blood. So the high density lipoprotein acts as a scavenger because it carries cholesterol away from the arteries and back to the liver for excretion or removal. Okay, what is the recommended level of saturated fat? In most of the cases, scientists recommend that we need to maintain the saturated fat intake less than 10% of the calorie intake. Okay, what the global guideline says, the 2020 to 2025 dietary guideline for Americans recommend limiting intake to less than 10% of total daily calories. Even the American Heart Association suggests even a strictly lower to 5 to 6% of those needing to lower their LDL cholesterol. If you already are aware of your cholesterol level, and if it is more than the recommended level, then you have to restrict your saturated fat intake to 5 to 6% of your total daily calorie intake. Okay, what is the biological mechanism of this saturated fat? The liver receptors. Saturated fat can suppress low density lipoprotein receptors activity in the liver, leading to high level of circulating cholesterol. You know what will happen? Liver normally produce about 80% of the total cholesterol needed for the body, but if we continue consuming saturated fat on top of what is internally produced, then it inhibits or it blinds the liver receptor of LDL, meaning while the internal production continue, then we will consume additional cholesterol, which will end up to create a problem, meaning that the level of cholesterol in our blood will be higher than the recommended, because the liver will not have or will not sense to remove the extra cholesterol entering to our bloodstream. Okay, the other one is the fatty acid impact. The palmitic and myristic acid are potent driver of ApoB, the main protein component of the harmful LDL particles. The other one is particle size. Excessive intake shifts the body towards producing more cholesterol, enriched atherosclerosis, promoting LDL. The atherosclerosis risk. When LDL cholesterol is too high, it seeps into arterial wall and oxidizes, triggering an immune response. This process creates plaque, a hard, waxy substance that narrows the arteries. We call it this one, atherosclerosis, significantly increase the risk of heart attack and stroke. Okay, comparative impact of dietary fats. Fat category, when you see saturated fat, it increases the LDL impact, it increases the LDL, and a state is usually solid at room temperature, and the typical source, butter, fatty meat, and cheese. Monounsaturated fat, it decreases the LDL impact, and those are liquid at room temperature. Typical source are olive oil, avocado, nuts. These are a good source of monounsaturated fat. Polyunsaturated fat also decrease LDL impact and liquid at room temperature. Typical source are fatty fish, walnut, and flax. Trans fat are heavily increased LDL, and these are also solid at room temperature. Fried food and pastries are a good source of trans fat. Common source of saturated fat, as you can see from the chart, meat and poultry, it accounts about 35%, whereas dairy products account 30%, and processed snacks, it contribute about 20%, and cooking oil is about 15%. How do we manage tropical and healthy fat? Okay, so we need to be careful about tropical oil. Tropical oils, palm and coconut oil, are high in LDL, raising fatty acid. So we need to be conscious of consuming this kind of oil. Healthy swap. And healthy unsaturated fats, it includes olive oil, nuts, provide essential unsaturated fats. So these are a good mechanism to balance between the saturated and unsaturated one. And we need to consume by comparing the amount we are taking daily. Okay, so the heart focus. Reducing saturated fat is a primary step to heart longevity. Key recommendations are here. Replace solid fats, swap butter and lard for liquid plant oil like olive, canola oil, soybean oil in your cooking. Choose lean protein. Opt for skinless poultry, fish, bean, or lentils over marbled red meat and sausage. Read nutrition label. Look for saturated fat content and aim for products with lowest daily value percentage. Watch the tropical oil. Be cautious of commercial baked goods, which often hide palm oil as shelf-stable saturated fat. Okay, if you have any question, please drop me, and I'm very ready to read those questions and answer. Thank you.